Hello all, welcome to this tutorial on the applications of nanomaterials in endometriosis treatment. So endometriosis is a common gynecological disease affecting women of childbearing age, which is characterized by the symptoms such as painful menstruation, abdominal pain, and infertility. So traditional treatments like drugs and surgery often faces limitations which include a high recurrence rate and complications that significantly impact the quality of life. Nanotechnology offers a promising new approach by utilizing nanomaterials that can directly treat endometriosis or enhance the therapeutics through targeted drug delivery systems, including drugs, siRNA, or antibodies and vesicles. So in this tutorial, we will explore how nanomaterials are revolutionizing endometriosis treatments through improved drug delivery, targeted therapies, and advanced imaging um, techniques. So let's start. So as I mentioned, this endometriosis is a common chronic inflammatory gynecological disease characterized by the endometriotic lesion present outside the uterine cavity. So the main clinical symptoms of endometriosis are dysmenorrhea, pelvic pain, and infertility. So endometriosis is a benign disease. According to the site of occurrence, this endometriosis is uh, can divide into three, like ovarian endometriosis. So this is also called as ectopic endometriosis, and these endometrial tissues form cysts on the ovaries due to the old blood content, and this cyst may cause pain and infertility issues, and in this case the cyst is localized on the ovary. Another type of endometriosis is peritoneal endometriosis. So in peritoneal endometriosis, uh, superficial there is a superficial implants on the endometrial tissues on the peritoneum. That means there are often small uh, lesion, scattered lesion, causing inflammation and pain. So this shows a small patches on the abdominal cavity lining. Another type of endometriosis is deep infiltrating endometriosis. So in this case, there are these cells are present more than 5 millimeter under the peritoneal surface, and this type of is often associated with the severe pain and anatomical distortion. So early diagnosis of endometriosis is difficult and challenging, as I mentioned earlier, and currently use different imaging modalities such as ultrasound, MRI, and hysteroscopy. So hysteroscopy is widely considered the gold standard for the diagnosis of endometriosis. And at present, the treatment of endometriosis involve both drugs and surgery. So drugs which lower the estrogen to reduce the pain, but may cause side effects like nausea, headache, and sleep disturbance with a long time use. So surgery can remove the lesion effectively, but has a high recurrence rate of 40 to 50% within 5 years, which significantly impacting the patient life. Okay, therefore we need a new treatment modality. So this nanoparticles material based therapies for endometriosis treatment. So as we know, nanomaterials based therapeutic agents or drug delivery carriers have great potential in biomedical applications due to their unique characteristics. So this nanomaterial can be used as a therapeutic agent to treat the endometriosis, including nano-based drug therapy or gene therapy or hyperthermia, both like magnetic or photo, thermal therapy or immunotherapy. So recently, this nanoceria to treat the endometriosis, like a study used this nanoceria for treating the endometriosis. So as we know, this cerium oxide nanoparticle used in the treatment of disease related to the oxidative stress. So compared with, so in this study, they used this cerium nanoparticle for treating the endometriosis. And as the result, compared with the control mice, they studied in the in vivo model, and this nanoceria significantly reduced endometrial lesion via decreasing the oxidative stress markers and angiogenesis in the endometriosis induced mice. And another nanoparticles are like a polymeric nanoparticle as a carrier for endometriosis treatment. Polymeric nanoparticles are produced by natural or synthetic polymers. So with that we can use for a suitable carrier for the drugs. So polymeric nanoparticle possess many properties suitable for the nano delivery of nucleic acids or drugs due to their easy surface modification, good stability, high safety, and favorable biocompatibility. So here in an example of polymeric nanoparticle for endometriosis therapy. So if this is like a chitosan PEI hyaluronic acid conjugated with AQPT2 siRNA suppressed endometriosis lesion. So here this Saho et al. They synthesize a nanocarrier using this composite like the chitosan PEI hyaluronic acid and small siRNA they use for as a nanocarrier. And this hyaluronic acid can bind to the CD44 which is overexpressed in the endometriosis lesion. And this AQPT siRNA was applied where AQPT is related to the progression of endometriosis. So the result showed that these composite nanoparticles significantly inhibited the development of endometriosis with a low expression of CD44 in the rat model. Another nanomaterial based strategy is nanomaterial based magnetic hyperthermia for endometriosis treatments. So as we know that this magnetic nanoparticle hyperthermia is a novel non-invasive method for tumor treatment, and these magnetic nanoparticles are delivered to the tumor region and induce the generation of heat under the alternative magnetic field via hysteresis loss or relaxation, either Neal or the Brownian relaxation. So then these tumor cells are killed when this local temperature exceed the 42 degrees Celsius and above. So there are a few studies this magnetic nanoparticle used in the treatment of endometriosis. Here Park et al. They demonstrated the efficacy of magnetic nanoparticle hyperthermia in endometriosis. So they developed a hexagonal iron oxide nanoparticle coated by polyethylene glycol and poly PCl like polycaprolactone and a based nanocarrier. So this which are then modified with the peptide to target the vascular endothelial growth factor receptor 2 or this KDR. So the developed nanoparticle had the advantages of high targeting efficacy and heating effect to endometriotic cells. And they studied in both in vitro and in vivo. So this particle could able to raise the temperature above 46 degrees Celsius and above, and um, more quickly, and the effect of this heating effect lasted for a longer time. So the nanoparticle kill more endometriotic cells in the presence of an alternative field here, and so this is the result. So overall, this endometriosis has seriously affected the quality of life of women of childbearing age. So therefore, it is essential to develop an effective approach to treat this disease. So there are thousands of studies have been conducted using nanoparticles, but there is a series of challenges that limit the transition of nanomedicine from bench to bedside. So therefore, more research is needed to clarify that limitations may have great potential in treatment of endometriosis to obtain favorable therapeutic effect. So thank you for watching. See you soon with another interesting topic. Stay tuned.